Hi everyone, my name is Dr. Asad Akhtar, and we're here to show the neurological examination today. Some of you may have watched the older videos, so we're just here to bring it back into the modern era. First thing in any neurological examination is you want to make sure that you're practicing good sanitation habits. So we're just going to go over here and wash your hands before we begin anything. So it's very important to be thorough while you're washing your hands. You want to make sure you get in between your fingers and in between the nails. And I think that should be good. Try and get up to your wrists a little bit. And try using a tissue to close the sink. You don't want to spray any more germs. Let's just get those off. Toss them in the trash. Alright, great. Now we can begin our neurological exam. We have a great volunteer here. Do you want to introduce yourself?
Hi.
This is Dale. Thank you so much for volunteering, Dale. So first
You're welcome.
Thank you. We're going to test out drift. So Dale, can you please raise your arms out like this?
Yeah.
Thank you. Alright, now just flip them over. Alright, now to your arms, to your shoulders, to your head. Okay, and now down to your hips. Alright, thanks. So, can you say a Macarena?
Hi, Macarena.
Thanks. So, vocals are good, gait's good. While he was doing that, we noticed, Dale, you're wearing a watch on your right foot. Are you right-footed?
Actually, I'm left-footed.
Okay, this is good. Most people wear their watch on their opposite foot, so no neurological defects over there. Next, we're going to test out his reflexes. So to do this, we'll just hit the patella. Alright, all good over there. You want to make sure you silence it before you move on to the next one. I don't want any interferences. And over here. Okay, so his reflexes are good. Alright, after that, we want to check out is anything else resistance maybe. So we'll do the clap knife response. So Dale, can you please take these two knives and just clap them together? Alright, thank you. Everything seems good. As you guys know, there's no pyramidal defects there. Alright, thanks Dale. You can stop. Those back, thank you. And next we'll move on to the examination of the cranial nerves.
Hello, my name is Dr. Nicholas Meinauer. I am from the Mayo Clinic, Department of Pediatrics, and I'm here today to tell you how to perform a neurological assessment. And I'm specifically going to be showing you the cranial nerve section. So first part of the test is to check the patient's hearing. So to do this, you're going to want to use a standard four-pronged fork, and you're going to want to just hold it up next to the patient, maybe add a few scoops, and ask, Dale, can you hear that?
Yeah.
Okay,
I can
good.
hear it, yeah.
So that's normal. And again, make sure to test the left as well. Do you hear that, Dale?
Yeah, I can hear it.
Perfect. Thank you. Next up, we are going to want to check the patient's pupillary responses. So again, with this, we are checking the sympathetics, making sure we see constriction of the pupils. And typically, we like to use a 500-watt lamp. You can pick these up at usually a large electrical supply warehouse, or sometimes Home Depot carry these. So we're gonna, yes, please have the patient look up to the lamp. And it's good because you can actually check both pupils at the same time with this. Just turn the lamp on. Perfect. And his pupils there were so small that I didn't even see them. Good. You're doing great, Dale.
Thanks.
You're doing great. Next up, you're going to want to make sure that the patient can demonstrate a visual acuity test. So you're going to want to give the patient the instrument. Good. Thank you, Dale. Next, you're going to want to check the muscles that control the orbital movements. To do this, you're usually going to just use a finger, is easiest, and ask the patient to follow the finger with their eyes. Dale, if you want to just follow. Good. Perfect. Up. Good. Perfect. The next test we're going to perform is the trigeminal test. So for this, we are testing the senses of the face. So again, you want to check the 3 regions to make sure you test all the trigeminal parts. So. Did you feel that?
I felt it, yeah.
Okay, perfect. And sometimes actually, it's best to maybe even just kind of wipe sometimes the patient's sweat gets in the way of being able to perform this test correctly. So normally after touching the patient's face, I would put gloves on and wash my hands again, but for the purposes of this demonstration, we'll skip that. Did you feel that?
Did.
Good. Good. And it should. I'm pressing fairly hard here. It should be somewhat painful for the patient. Did you feel that?
It's excruciating, yeah.
Last part. Did you feel that?
Yep.
Good. Again, this instrument I'm using isn't the best. You're probably going to want to pick up one of these from the bookstore and not offline or anything like that. Perfect. Now we are going to check last part. Or second to last part of our neurological assessment. We're going to want to check the patient's ability to smile. So Dale, I'll have you show me those pearly whites. Yeah, okay, that's good. Now stop. You can close. Good. Good. That was, you have a really great smile.
Thank you.
You want to make sure they have a good smile. Last part of the exam is the gag reflex. So typically when you're doing this with your standardized patients, it's going to be excruciatingly uncomfortable for them. So we'll ask you during your OSCEs to not actually perform the gag reflex part of the neurological assessment. But Dale here has agreed, for the purposes of teaching, to undergo the gag reflex. So go over here to our nickelback button. Oh, yeah. Good. Good. That's great. So that's, I know it's uncomfortable, but we have to check it. And again, that's the normal gag response you're going to want to see. That concludes our cranial nerve assessment. Again, I'm Dr. Nicholas Meinauer. And thank you.
Welcome. My name is Dr. Philip Henry, and I'm here to demonstrate an adult cerebellar function examination. Here we have Dale. As you can see, he's already wearing his ransom grade blindfold. Dale, do you normally wear eyeglasses or spectacles?
I do, yeah.
Okay, go ahead and put those on, please. Very important for the patient to have full vision under their blindfolds. Now, the first exam is about gait. So we're going to have Dale step up from the examination table. And you're going to want to throw him a bit off balance, so give him maybe 1, 2, anywhere between 5 and maybe 8 swings around. And then just have him walk. Alright, he's looking pretty good there. Now, on the next part of the examination, we're going to examine his proprioception to make sure that he has a good idea of where my body parts are. Now, Dale, as I move my arms, just tell me which direction they're going. It is going up or down?
It's going up.
And now?
It's going down.
And left arm?
And it's going down.
And?
Going up.
Perfectly done. Now, Dale's going to do a get up and go for us, demonstrate his muscular strength, so just have him sit down in a chair. You're going to want to get up and down from that chair 5 times. Alright, are you ready?
Yeah.
Go. So 1, 2, and on the 3rd, pull it out. And Dale performed exactly as we'd expect. Let the patient get up under their own power as a true demonstration of muscular strength. All right, and Dale's back on his feet, which means that it's time for the last portion of the examination, the cremaster reflex. Dale, go ahead and drop those pants for me, please.
Okay.